Hello, my name is Testagrose, and I will be presenting on the impact of concatenation of digital craniocaudal mammography images on a deep learning breast density classifier using Inception V3 and VIT. Breast density is often used to determine a patient's risk of developing breast cancer. Increased density levels carry with them this increased risk. Along with this increased risk, dense regions can also obscure tumors from view, masking the tumor and making proper diagnosis more challenging. Determination of a patient's breast density follows a four-class framework outlined by BI-RADS. Classes range from A, which is entirely fatty, to D, which is categorized as extremely dense. In breast density screenings, radiologists examine a patient's mammogram images. These mammogram images provide radiologists with a view of the internal tissues of both of a patient's breasts. After examining the images, radiologists will then assign a breast density level to the patient. There is a possibility that due to the natural asymmetry exhibited by the human body, there may be differing density values between breasts. In this case, radiologists will assign the density level based on the breast with the higher or worse density. This poses a challenge to the training of deep learning breast density classifiers. Most deep learning breast density classifiers are trained on individual mammogram images with the ground truth label being assigned to the patient. This use of patient labels on individual mammogram images can introduce error into the training of the deep learning classifier and negatively impact the performance of the classifier. In larger general mammogram datasets, it is not feasible to re-annotate each image to ensure that an individual breast density ground truth label is being used instead of a patient-based ground truth label. In order to avoid introducing this error into the training of the deep learning breast density classifier, we propose concatenating the mammogram images from both a patient's left and right breast together to form a single image containing the view of both breasts. We believe that this method of training will allow the classifier to focus on the breast with a higher density and provide a more accurate breast density classification to the patient. We trained deep learning models of Inception V3 and Vision Transformer using PyTorch machine learning framework. The MONAI machine learning toolkit was also used in the training of these models. Using transfer learning, models were pre-trained on ImageNet and fine-tuned on our breast density datasets. Concatenated images were created by concatenating one left and one right craniocaudal image per patient to form a single image, and all models were trained for 100 epochs. When using Inception V3 and concatenated images, we see an average increase of 2% to validation and test accuracy, as well as to the macro and weighted F1 scores. Concatenation also provided, on average, a 2% increase to Class B area under the curve. When using VIT and concatenated images, we see on average a 1.4% increase to validation and test accuracy, as well as an increase of 1.4% to the weighted F1 score. The macro F1 score saw an increase of 2.2%. Area under the curve when using concatenated images saw up to 3% increase on average when using VIT. To conclude, when using concatenated images, accuracy saw an average of 2% increase when using Inception V3, and an average of 1.4% increase when using Vision Transformer. Concatenation also provided up to a 3% increase to the area under the curves. This concludes my presentation. Thank you for listening.